Good evening again. Exceptional meeting with Dr. Florinella Stojanovici. I am Alice Nastase Buciuta, and I'm happy to be at a new edition of the interactive live webinar with Dr. Florinella Stojanovici. Holistic medicine brings doctor information related to paternal behavioral influences. This time, last time, we talked more about the maternal influences that lead to diseases to the child who will become an adult. Parents, today's adults, ready to understand how much the child's future depends.
Good evening, Alice. They are and they are not, because we will see that there are many things that influence us. There are many things that are both favorable and unfavorable to us, because indeed, as you said, there is an influence from the mother, but also from the father. We will see that, in fact, the father's behavior is not so much this genetic part as much as more, because that in general is from the mother more. But the behavioral part of both the mother and the father can influence the health of children. It's very, very, very important. And our children know that in general, the neonatologist who sees the child first analyzes the physical appearance. If we look, you know well that the first thing gained is that we always look when we give birth to a child, if it has all the fingers, if it has all the little hands, if it looks good, and we look anatomically, we look at the physical part. But the neonatologist has no way of measuring, for example, the traumas transmitted during the baby's pregnancy. It is very important for the mother, for example, because of her behavior, but also because of those around her. And that's why we have a lot of people who are pregnant with trauma. We have a lot of, let's say, exceptional situations in which you practically can't control everything in life. And these traumas that are during pregnancy will be seen over time. They will be seen later in the other bodies, not in the body physical. The child looks good, but he may have experienced an emotional shock or a mental shock, or at the soul level, he may have been very affected. And that is why I am not referring to the genetic endowment here, but I am referring to the behavioral one, to situations, to the environment that can to influence the child emotionally. So this year's 2025 stake is a healthy child on earth. That is, without getting autoimmune diseases or cancer at the age of 20, 30, 40, 50. Because we know that I have patients in the clinic at 33 years old with serious diseases, with very serious diseases, with disabilities, or even with cancer. And then how can we, and this is our discussion throughout this year, which will end with a course on the healthy child who is also upgraded from a mental and emotional point of view, that is to be a spiritual child, is already very interesting. I was saying that I started from this idea of the spiritual child, having my granddaughter as a landmark, who already has the behavior of a spiritual child. And this is not because she is special, because each child is special. So we are born here on earth. Each child comes completely to the maximum of 11 and special. But due to the situation, due to the traumas of the mother, due to the behavior of the father, of the family, on the mother's side, on the father's side, the in-laws, as it were, due to the co-workers of gravity, and due to society and the whole situation, traumas can happen. And due to the interrelationship between them, traumas can happen that attention trigger or button, in fact, what will follow in the future related to the child's health. And let's see a few things, because look, it's very important. Practically everything related to the pregnant woman, that is everything that lasts, all the traumas that are in this period, all the small and big, everything related to the fights in the house, absolutely everything influences the baby in another way, in a different way, another level that it will impact his health from an emotional point of view. And I'm talking to you about this as a doctor who treats adults at this time. And when we cleanse the energetically preserved layer, we reach the period of childhood with traumas, and we basically identify certain situations that took place in childhood. Today, I had a patient who was theoretically very well. That is, she was married, her husband was fine, she had twin children, at work she was fine, and yet she had a very great sadness, and she was also angry and a very big blockage. And I asked her what the problem was, and I got the information to ask her because everything seemed fine about her father. And what happened is that she lost her father. That is, she was very close to her father until she was 16, after which she had a really good relationship, after which her father left. I only asked two questions. How did you heal this situation? How do you proceed to cure such a situation? And a second question, what happens in cases where we don't know our parents, or we don't know only the father, or we don't know either the father or the mother? We are at the orphanage. How can we manage this relationship? our relationships with the souls around us, that is our parents, and with absolutely anyone who is not on a physical level. So we don't necessarily have to know our parents, and we don't necessarily, for example, when we want to reconcile with someone, to go personally face to face to reconcile with them. Or if we want to apologize, or if we want to settle some things between two entities, there is no need for physical presence. There is a way to discuss with another entity, human being I speak, at the soul level. It's very simple. When you want to tell someone something, you go into a meditation and you can call them in front of you, and you can call him not his physical person, but his soul. And I want to tell you that at the level of a soul entity, it really has to come. So it comes for sure. And when he comes for sure, you can tell him what you have to say humbly and, of course, without accusations. That is, forgiveness implies both sides. And then you can order him to leave, and he leaves. So this can simply be done at the soul level, at another very high level of consciousness. We can clean up, or we can reconcile or forgive those parents who have abandoned us, or to tell them what we have to say and to part with them afterwards, because we have another path, they have another path. So things can be fixed on an energetic and spiritual level, and spiritually on a different level than the physical encounter. I mean, I, for example, discussed, regulated, helped certain people to regulate their behavior in the family, because, for example, my mother and daughter-in-law didn't speak and lived in the same house, and they had a very big conflict. I was with my grandmother, with my mother-in-law. She was my patient, and I advised her to be able to settle these things with her daughter-in-law without talking to her at all. I mean, that's what you asked me. But there was another question you asked. How was that situation cured? You said that you have the patient who had trauma related to her father, how things are healed so much. I treated it from the lung, but it is also related to the soul part. You should know that in general, depression is cured by triple warmer meridian treatment, and there are 4 hours of treatment for depression. There are entire programs, but I usually also treat the pain of the soul, which accompanies depression. And then I treat the lung, I treat the digestive part, because you know that the stomach and the small intestines are the second brain. So basically, I treat. This is actually the secret in holistic medicine, because by knowing these energetic connections, we can really heal diseases, because we only treat the organ that is affected. We also treat what is around energetics. That is, we treat, let's say, I'll give you an example. If we want to treat the kidneys, we also treat the lung, because the lung is the mother of the kidneys, but we also treat the child of the kidneys, which is the liver. I mean, we somehow treat this energy family in this connection of energy source, which is not taught in the faculty of classical medicine and gives some extraordinary results. Monica Anastasi asks us, what are the causes of varicose veins and how they can be treated? Yes, I'll explain it to him once again. I've said it many times, but just today I had a patient in the office, a very special lawyer who understood clearly. I explained to her very simply what she looked like. I'll say one more time related to the system. First of all, varicose veins are tumor formations of the wall of blood vessels, respectively of the veins. So there are some dilations of the veins. Veins and arteries are subordinates of the heart, because we are talking about the cardiovascular system.
So, in other words, varicose veins are a heart disease because the boss has problems. And now, why do you happen to have heart problems?
You will see that the underlying cause is the liver, but between the liver and the heart, there is such a close connection that the liver is the mother of the heart. In other words, if you have liver problems, for example, you are a perfectionist, a dominatrix, or a person who gets very upset, that you take things to heart, and so it can be, and you get upset about anything, and you are very vulnerable and sensitive, you make the liver sick. The liver no longer nourishes the heart well, and then the heart and especially the blood vessels become ill for the first time. And what does it look like? The heart is quadricameral. At the top are the atria, at the bottom are the ventricles. You know, it's divided into 4 and has this shape, and the bottom respectively, the left ventricle is the star. It contracts and pushes blood into the aorta. From the aorta, it goes through the arteries to the kidneys. The blood is washed of toxins there. Part of the toxins go through the urine out. Then it goes to the digestive part, to the colon, which is the second filter. The kidney is the first. The second filter is the colon. There it really cleanses certain ones. It carries blood with nutrients to the colon. It is eliminated, and there it is cleaned as much as it is cleaned. We go further, and on its way to the liver, The return is related through the veins, and these veins, because the liver is blocked, that is energetically either hepatosteatosis or hydatid cysts in the liver or various other problems, a chronic hepatitis with various viruses, then the liver is with resistance and the poor veins push into the liver, and at some point, because they can't get through, they dilate so that they can push even more. I would like to present the case of a patient who came to us as a child, a little boy, who came to us with some problems, let's say at the level of nerves. So he had some problems on the nervous system, not central, peripheral, and he also had a problem in the sense that his legs were not straight. His legs had a dysfunctional problem at the bone level. And this, if you notice, I don't know if he looks big enough, we can zoom in here to see, there are problems, especially the first one, the yellow meridian, which can be seen there, writes BL. BL stands for bladder in English, and this is the child's energy pattern. Then you see here, notice that in fact, the bladder problems, being sick, being infected with infection probably taken from pregnancy, reach the brain. Notice the bladder goes all the way up, and from there the problems all over the spine, because all the nerves start from the spine, and he had problems precisely on the peripheral nervous system, which started from the whole spine. And more than that, we noticed that there were problems with the legs as well. You should know that you notice the kidney meridian passes through the leg. We go on to my father. What do you notice? My father also consulted, and notice that he also had a gallbladder. You basically see a legacy here, right? Informational. And let's see my mother's house. This is the mother who seems healthy, but she is not, because we have not yet opened it. The first time the patient comes, the energy system may be shut down. Here is a closed energy system that has not been acted upon. At the first treatment, it opens and appears here, and we see what the problems are. But notice the same BL, it also appears here, vesicular bladder. Understand? Basically, I noticed that this family had this issue in common, which is not of a genetic nature, it is of a behavioral nature. What does gallbladder mean? The gallbladder is simply the protector of the kidney and has to do with insecurity, and it has to do with a feeling that you are not protected. He has a feeling that you are separate from the divine. That is, the people who are on earth are not connected to the divinity to know that they are protected and do not have enough trust and safety.